In most developed nations, universal healthcare systems and robust social safety nets prevent patients from incurring life-altering medical debt. However, a developed economy does not always guarantee affordable care at the point of service. Based on 2024-2026 data from the OECD and the Commonwealth Fund, here are the top 10 developed countries where patients struggle most with medical bills, ranked primarily by the percentage of the population reporting financial barriers to care. 1. United States. The U.S. remains the only high-income nation where medical debt is a leading cause of bankruptcy. As of 2026, roughly 38% of adults report skipping or delaying care due to cost. Even with insurance, high deductibles and the expiration of pandemic-era subsidies have led to a surge in underinsurance, where patients are technically covered but cannot afford the out-of-pocket costs. 2. Switzerland. While Switzerland has world-class outcomes, it also has one of the highest cost-sharing models in Europe. Residents must pay a deductible, franchise, and a 10% copayment on all services. For middle-income households, these fixed costs can lead to significant financial strain, and the country ranks nearly as low as the U.S. in administrative efficiency due to complex billing disputes. 3. Greece. Following years of austerity, Greece's healthcare system requires significant out-of-pocket (WOPI) contributions. Patients often face informal payments or must pay for medications and specialized tests upfront. It has the highest rate of catastrophic health expenditure in the EU, meaning many households spend more than 40% of their non-essential income on health. 4. Australia. The dental specialist gap. Australia ranks highly for general care, but it has a massive affordability gap for dental and specialist services because many specialists charge above the Medicare subsidized rate. Patients often pay hundreds of dollars in gap fees. Over 20% of lower-income Australians report delaying dental care because of the bill. 5. Canada. Prescription dental costs. Canada's universal system excludes 12 major areas: prescription drugs and dental care. While hospital visits are free, many Canadians, particularly those in precarious work, lack private insurance for medications. This leads to high rates of non-adherence, patients not filling prescriptions because they can't afford them. 6. Poland. Poland has one of the highest out-of-pocket spending rates in the OECD. Long wait times in the public sector drive patients to seek private specialists, which they must pay for entirely on their own. This dual system creates a heavy financial burden for those with chronic illnesses who cannot afford to wait for public treatment. 7. Portugal. Similar to Greece and Poland, Portugal relies heavily on user fees. While the fees for primary care were recently reduced, the cost of specialized diagnostic tests and pharmaceuticals remains a significant burden for the elderly and low-income populations. 8. South Korea. South Korea has universal coverage, but benefit package is relatively narrow. High copayments for advanced technology, specialized surgeries, and long-term care mean that families often face high bills for serious illnesses like cancer, requiring them to use personal savings. 9. New Zealand. New Zealand faces challenges with GP fees. Unlike the UK, where primary care is free at the point of use, most New Zealanders pay a co-pay to see a family doctor. For many families, especially in rural areas, these accumulating fees lead to significant medical debt or deferred treatment. 10. Hungary. Hungary's system is plagued by underfunding, which results in high out-of-pocket costs for medications and medical devices. It also has a historical culture of gratitude money, informal payments to doctors, which, despite government efforts to ban it, continues to be a financial barrier for patients seeking timely or quality care.